The cause of death was listed as a non-fatal traumatic brain injury resulting from a fall. The medical examiner disagreed, citing 3 forensic indicators that suggested the severity and timing of the trauma were critically misinterpreted in the initial report. Evidence of subdural hematoma formation indicative of an acute head impact. Retinal hemorrhages consistent with rotational forces sustained during a high-velocity fall, and multiple rib fractures occurring at different stages of healing, suggesting repeated falls or impacts prior to the fatal incident. The cause of death was listed as a non-fatal traumatic brain injury resulting from a fall. These findings collectively pointed to a complex sequence of events leading to fatal traumatic brain injury, necessitating a thorough reevaluation of the circumstances surrounding the deceased's final moments. Chapter: Case Background. The incident under investigation occurred at a single-family residence located in suburban Chicago on October 15th. The discovery of the deceased was made by a family member returning from an extended absence, who noted the individual had not been seen or heard for several days prior to entry into the home. Upon entering, this person observed that the deceased was found lying prone near the base of a staircase within the house, initially assumed to be a sudden and unexpected health event due to lack of visible signs of trauma on the body exterior, such as lacerations or contusions. The family member contacted emergency services, which then initiated a standard protocol for unattended deaths. Upon entering, this person observed that the deceased was found lying prone near the base of a staircase within the house. The responding medical examiner's office conducted an initial examination and documented the scene before removal of the deceased to their facilities. This case investigation commenced with these observations and assumptions, later revealing deeper complexities upon further forensic analysis. Chapter: Initial findings. Upon arrival at the residence, first responders noted the deceased lying supine on the floor of a bedroom. The scene was cordoned off to preserve potential evidence. No signs of forced entry were observed. A bedside table nearby contained a spillage consistent with medication bottles and glasses, suggesting an accidental or involuntary fall from standing height. The initial medical assessment revealed multiple abrasions along the lateral aspect of the upper extremities and forehead, indicative of impact against rough surfaces during descent. However, there was no evidence of fractures upon cursory examination. The most concerning finding was a large hematoma overlying the left parietal region, consistent with blunt force trauma from impact. This raised suspicion for a traumatic brain injury given the location. The deceased's level of consciousness was Glasgow Coma Scale, GCS, 3, indicating deep unresponsiveness and necessitating immediate emergency transport to medical facilities. The initial manner of death was classified as undetermined pending further investigation into the cause of head trauma and overall circumstances surrounding the fall. Chapter: Forensic Investigation. At the scene, various items were collected for forensic examination, including a broken pair of eyeglasses and fragments of ceramic from a shattered coffee mug found near the deceased's body. Swabs and samples were taken from suspected impact areas on both the floor and surrounding furniture to detect biological evidence such as blood or tissue residue. Notably absent was any sign of external trauma consistent with direct blunt force, suggesting the fall may have been uncontrolled due to compromised balance or coordination. The chain of custody was meticulously maintained, ensuring all collected items were documented, sealed, and tagged for laboratory analysis. This collection process aimed to provide a comprehensive understanding of the incident leading to the deceased's traumatic brain injury. Autopsy revealed a significant traumatic brain injury in the deceased, necessitating comprehensive laboratory analysis to elucidate the extent and nature of intracranial trauma. Blood samples were assayed for markers of acute ischemia and neuronal damage, including neuron-specific enolase, NSE, and S100 calcium-binding protein B, S100B, with detection thresholds set at 5 ng/ml and 0.3 micro g/L respectively. Cerebrospinal fluid, CSF, was examined for the presence of glial fibrillary acidic protein, GFAP, and ubiquitin carboxyl terminal hydrolase, L1-UTCH-L1, as indicators of axonal injury, with detection thresholds at 5 pg/ml and 400 pg/ml. Histological sections from brain tissue were stained with hematoxylin and eosin to assess for hemorrhage, contusion, and diffuse axonal injury. Microscopic evaluation confirmed the presence of perivascular petechial hemorrhages and evidence of neuronal necrosis, consistent with severe traumatic brain insult. Forensic analysis indicated that the deceased had sustained a traumatic brain injury as a result of falling from an elevated position. The sequence of events was reconstructed through examination of the scene, where witness statements corroborated that the deceased was observed ascending to a height of approximately 10 feet before losing balance and descending. Impact fractures on the occipital region of the skull confirmed the fall's mechanism of injury. Postmortem interval, PMI, determination involved analysis of body temperature and rigor mortis onset. The latter stages of PMI were estimated at 12-24 hours post-fall, aligning with the timing reported by witnesses who noticed the deceased had not returned to ground level for an extended period prior to discovery. The timeline established corroborated witness reports regarding the time frame, but contradicted initial speculation that environmental factors such as slippery surfaces may have exacerbated the fall. The absence of external injuries indicative of a struggle further reinforced this conclusion. The forensic examination revealed multiple contusions and lacerations to the scalp consistent with blunt force trauma, indicative of a significant impact to the head upon striking a hard surface. Radiographic imaging demonstrated fractures of the anterior cranial fossa, including the orbital plates and ethmoid bone, suggesting an acceleration-deceleration mechanism at the time of injury. The presence of subdural hematoma confirmed intracranial bleeding secondary to traumatic forces exerted on the brain parenchyma. While the exact cause of impact cannot be definitively determined without eyewitness testimony or corroborative evidence, the pattern and distribution of injuries strongly suggest a fall from a height exceeding 2 meters. Under oath, an expert would opine that these findings unequivocally establish the presence of traumatic brain injury as the primary causative factor in the deceased's demise, with the specific mechanism likely being a fall followed by direct impact to the head. While the exact cause of impact cannot be definitively determined without eyewitness testimony or corroborative evidence, the pattern and distribution of injuries strongly suggest a fall from a height exceeding 2 meters. Chapter: Resolution upon comprehensive evaluation of all available data including medical records, autopsy findings, witness statements, and environmental evidence. The final determination is that the deceased sustained a traumatic brain injury as a result of a fall from significant height. While the exact cause of impact cannot be definitively determined without eyewitness testimony or corroborative evidence, the pattern and distribution of injuries strongly suggest a fall from a height exceeding 2 meters. Initial assessment suggested multiple blunt force trauma injuries consistent with a high-impact collision event. However, subsequent analysis revealed a primary impact site on the occipital region of the skull, indicative of deceleration forces occurring upon contact with a hard surface. Neuropathological examination confirmed diffuse axonal injury and subdural hematoma, characteristic of rotational acceleration-deceleration trauma often seen in falls from elevated positions. This evidence substantiates the central finding that the primary cause of death was traumatic brain injury resulting from an acute fall event rather than any pre-existing medical conditions. Notably, changes from initial findings included refining the nature and extent of head injuries by excluding contributing factors such as direct blunt force trauma to other body regions or environmental hazards. Thus, the case concluded with a clear establishment of the central finding through meticulous correlation between clinical history and forensic evidence. This case underscores the critical importance of a thorough examination in distinguishing between primary and secondary injuries. detailed neuropathological analysis is essential for accurate determination of causation in traumatic brain injury cases, particularly when considering potential mechanisms such as falls. The file remains open.